From few days, I was really busy. I could not do any lives. How are you? I hope everyone is doing good. So in this live session, we shall talk about basic knee problems. So we shall talk about the anatomy of the knee joint. So you can see here, this is the quadriceps tendon, this is the patella, and this is the patellar tendon. Okay, the small bone in the side is called the fibula. This is the tibia, and this upper bone is the femur. The blue one is called the meniscus. So meniscus, the main role is it helps in shock absorption, and it's very important for the stability of the knee joint. So that is the reason why nowadays meniscus preservation, repair of the meniscus is given more importance than meniscectomy. So, and many patients ask me, sir, what is an ACL tear? In this X-ray, in this demo piece, you can see the inside ligament. I really want to know how much an orthopedic surgeon gets in UP. Yeah, brother, it depends upon how many patients you see. If your practice is good, I think approximately daily you can make, monthly you can make easily 2 lakhs. If your practice is really good and you are having your own hospital, I think you can make daily 10 to 15,000 in a day. So just see how many patients you are seeing and how many surgeries you are doing in a month. Small hospital, that's what, brother. It depends upon how many patients you are seeing. So many of the videos I make, most of the comments are regarding, sir, how much does orthopedic surgeon make, how much does the general physician make? These are the questions I am getting repeatedly. So in this video I'll talk about what is an ACL tear. So whenever there is a twist injury for the knee joint while playing, or it can be even due to trauma, bike accidents, it's not just the bones, even the ligaments get damaged. So many of the times the patient himself goes to an X-ray, the X-ray is done, the X-ray will be normal. So patient thinks that as the X-ray is normal, there is no problem in the knee joint. So maybe in a week or 2 weeks, the patient again complains of pain in the knee joint, instability, not able to run, difficulty in walking and all. So then he comes to an orthopedic surgeon. On examination, there will be ligamentous. Sometimes you get anterior drawer test positive and all. So then we advise them to get an MRI scan done. Sometimes even without examination, by seeing the knee joint with basic examination, we can get an understanding that there is some kind of ligamentous injury to the knee joint. So then we advise an MRI scan. So patients immediately ask, sir, what is an MRI scan? So basically MRI means magnetic resonance imaging. It tells about the ligaments, soft tissues, capsule, the tendons, the muscles of the knee joint. So whenever there is an injury to the knee joint, whenever you suspect there is an ligamentous injury, it's always better to get an MRI scan done. So once an MRI is done, then according to the type of the tear and according to the type of meniscus tear, then we give the treatment options. So if there is a complete ACL tear, for example, if there is a complete ACL tear, if the patient has got the symptoms of instability, difficulty in running, difficulty in walking, difficulty in climbing the stairs, if the patient is facing difficulty in doing daily routine activities or activities of daily living, then we advise them to undergo surgery, that is arthroscopic ACL reconstruction. 5 minutes. 5 minutes. If the patient has got a partial ACL tear and if the patient is complaining of laxity, if the patient is having problem of instability or difficulty in walking or severe knee pain, not able to run, not able to, or difficulty in jumping, difficulty in climbing the stairs, then also we advise them arthroscopic examination, evaluation, and if we find the ACL is very lax, then intra we suggest them to go undergo for an ACL reconstruction. So coming to the meniscal tears, so there are different types of meniscal tears. So for example, if it's a complex tear, if it's an irreparable old complex tear, then we advise them to undergo a meniscectomy. And if it's an relatively fresh tear, young patient, bucket handle type of tear, or for example if it's a root tear, then we advise them to undergo a meniscus repair, because as I said earlier, meniscus is very important structure which plays an important role in the stability of the knee joint. Then comes to MCL. Usually MCL tears, grade 1 tears, we advise them conservative management, whereas grade 2 and grade 3 is definitely surgical management, and grade 2 it depends upon other factors as well. So that's the reason why along with the MRI report, it's always important to examine the knee joint of the patient. We have to examine the patient, so because ultimately we are giving treatment to the patient, not the MRI film. So because sometimes there can be a tear in the meniscus as reported in MRI, but intra-op there can be there need not be a tear, because always it's not 100% reliable. It doesn't have 100% sensitivity or 100% specificity. So that's the reason we should never go blindly with the findings of an MRI. Always it should be correlated with our clinical findings. So I hope this video is helpful to you. Thanks for watching, friends. If you have got any doubts in knee and knee injuries, you can always SMS me. Thanks for watching. Bye bye.